Well, I graduated from the University of British Columbia in 1987, and I'm a general dentist in North Vancouver. In around 1997, I became interested in improving visual acuity in practice. So I started using operating microscopes for all of my routine clinical dentistry, and I've been using them for 15 years now. And so I started doing some speaking on the application of microscopes in dentistry. And the same fellow that sold the microscopes sold lasers, and I ended up buying a laser, my first laser in 1997, and it was $54,000. It was 200 pounds, couldn't be used in any more than one room, and it did two things. It cured composite or composite resins, and it did some cutting of soft tissue. And so I started using lasers, but didn't know much about them, so actually started getting training in lasers from the Academy of Laser Dentistry, and ended up getting a mastership in laser dentistry. And just like the bad guys in the movies who always get penned in as bad guys in movies, I got penned in as the laser guy. So I always said it was better to be known as something like the laser guy than nothing at all, and that's how it started. So I lecture a fair amount on lasers in dentistry, and am known for that. And so I have a very busy private practice in North Vancouver now, and practice there and do some lecturing for different laser companies as well. I see, as I spoke in my lecture, a coming role for lasers in many areas of implant dentistry. I know how it's improved my implant dentistry, but I really felt like after 3 or 4 years of placing implants, I didn't have a total grasp on the literature, on one way of treating patients. My surgical skills weren't really up to the level it should have been, so I joined in January of 2013 the North American Master Implant Training course, and honestly, it was the best single thing I've ever done. It helped me in so many areas, know the literature, to get a comprehensive background on not only fundamentals of implants, but also soft tissue augmentation, which I really feel like I needed to get a better grasp on, and also hard tissue, horizontal, vertical augmentation, sinus lifting. There were a lot of added features here, and the organization behind the master implant training, the people that are speaking, the comprehensive nature of the course, it was really, honestly, it's the best single thing I did. And I wanted to improve my implant portion of my practice. So I did that, and I wanted to combine it with lasers. So that's what I ended up doing. I spent a good long year really trying to improve my clinical skills in lasers or in implants and the role of lasers in them, and I think I did so, and it was really a wonderful thing. I strongly encourage anybody who's watching these videos and thinking, I really need one course to tie everything together. I really strongly encourage you to invest the money and the time and the effort into taking the master training course, because it will really change your practice and your view on implants. You'll become much more confident, much more capable. So I strongly encourage you to do what I did. I think I'm technologically based. It's not like my parents where my VCR was flashing 12. And I've been able to, as a lecturer, implement digital technology. But the way that the format is with videos and the way that Guide has constructed this program, not only to be in person, but you go home and you watch videos, etc., was wonderful. But one of the best features of the Guide website is the forum and the membership forum, and it helped me because I could ask questions knowing that the people that responded would be thinking in a similar fashion to what I was going through training-wise. I was able to go back through past years and look at clinical cases and see people who had presented beautifully documented clinical cases and done tremendous surgery, and I learned a lot from looking at those. I was able to look and see clinical cases from my own group and also what people were doing, and I had struggles like they did. So the forum is a very, I think a lot of people are nervous because if they put something out there, somebody's going to really come down on them, but it's such a collegial aspect, and some of the people who are running like David and others who respond there are just wonderful clinicians, but wonderful people, and there's no ridiculing. It's just a safe environment to really ask for help. So the membership forum really was a big help to me during my master training. I learned a lot from just looking at past posts. You know, it's interesting because that you asked, Paul, because as I mentioned, in 1997, my first laser, we called it the Zamboni, which as a Canadian, you're cleaning ice rinks with. We used to have this Zamboni in the office. It was so big, $54,000. Soft tissue diode lasers now can come in $2,500 as they cost. They're small little packages, 2 pounds, and they're great for soft tissue work. So as opposed to an electrosurge, which can damage implants, and I talk about that in this lecture, that you really have to be cautious with electrosurge, soft tissue diodes are phenomenal because they work safely around implants. You can use them on abutments, you can use them around peri-implant soft tissue, and they're great. There is a growing excitement in many circles about the role of hard tissue lasers and other lasers for peri-implantitis. Their ability to safely remove biofilms and disinfect, all lasers disinfect, can be tremendous because really people have problems disinfecting around lasers, getting around the thread. So you get this implantoplasty. The lasers have been shown in research this year to remove biofilms, remove surface treatments like Ti-Unite, safely without generating heat, and we talk about that in the lecture as well. And in addition to not generating heat, the exciting part is you're getting bone re-osseointegrating on the implant surface after the surface like Ti-Unite is removed. So there's some really exciting stuff coming out in reputable journals now that seem to insinuate that really lasers can be beneficial for more than just soft tissue work and maybe helping us with ailing and failing implants. I've heard all sorts of excuses. You know, some people are surprised that the prices have fallen so far on lasers, like little soft tissue lasers, which used to be even 4 years ago. Gordon Christensen wrote an article that one of the barriers to soft tissue lasers being implemented routinely in private practice was their price. He seemed to insinuate, if you read between the lines in his article in 2008, it was in, I believe, the J Journal of General Dentistry, he said that, you know, there's a lot of value to lasers, but he couldn't justify the cost. So price now for these small lasers has dropped considerably, and that's a great entry point for dentists trying to get in as an electrosurge alternative, something that can be used safely around implants, and unlike an electrosurge, and that's a great starting point. The second thing is people think that as soon as you talk about lasers, that it's an out-of-the-box technology, that people are saying that you have to use this as a replacement. It isn't. It's an alternative and an adjunct to traditional treatment. And it can be used by everybody. I'm a general dentist, so you don't have to be just an implant guy, or you don't have to be just a laser guy. You can use it as a general practitioner in many ways, not only in implants, but in restorative dentistry, in soft tissue work. You can use your lasers routinely. You need training. I think you need to get a basic understanding of fundamentals for how lasers are different than traditional technologies and methodologies. But once the training's taken and you sort of build up your level of expertise, you become excited about some of the new options that are available to you. And I think that's what's happened. Prices come down. Training has gone up. There's more and more research coming out now, and I think it's becoming affordable for a lot of people. One of the things that you're seeing more and more now is people asking, well, when can I use a laser? What kind of things can I do? And so I've read some of the articles that are fantastic out there, but they don't really create a protocol or classification system for when your laser might be used. And in this lecture, what I try and cover is that lasers can be used before implants for disinfecting extraction sockets, for lateral sinus lifts, for removal of granulation tissue. They can be used during the implant process for creating a laser-assisted osteotomy, and there's benefits to that. After the implant is placed, low-level laser therapy improves wound healing, and actually there's evidence to show that maybe osseointegration is actually improved in the early periods. When you're doing uncovery with implants, there's exciting new methods which will limit the number of sutures, or less problems with bleeding. So you can use lasers for uncovery in traditional methods, or even just like a tissue punch method. And also, there's lasers being used when you have abutments and you have a crown that comes off and you can try to get your crown back on, and how difficult it is to do so. So I think I'm covering the lecture a little bit about different aspects in the timing of your implant treatment where maybe a laser could be pulled out and could be beneficial. And I think that's something that hopefully people, when they see the lecture, will say, hey, I never thought of that. That looks like I get that problem too, and maybe that little laser could help me. So I think that's one thing the lecture will really help people get a grasp on is, hey, maybe I can use a laser then. You know, it's interesting to see because patients, because of LASIK eye surgery, laser eye surgery, are very receptive to lasers. You know, more and more dentists now, I think roughly 40% of North American dentists have a soft tissue laser or a laser in their practice, and that's growing all the time. I see that by the questions I get repeatedly from all over the world on, you know, how do I use my laser? Every day routinely I get questions by email. And the patients, when you tell them I'm going to use a laser around your implant, they never say, oh, are you sure, or, you know, is that safe? The term laser has a reputation that makes it kind of like you are on the cutting edge, and so patients are very accepting of it. When I had electrosurge, not for implants, but electrosurge, I would put the pad underneath the patient's shoulder, and they would immediately say, "What are you doing?" I'd say, "I'm grounding you," you know, and they would laugh, and I would be laughing too. But the truth was, I was grounding them. So that was an old technology that worked very well, but had some serious ramifications, as I discussed in the lecture. So I think patients really are excited about lasers, and it kind of takes your practice to a new level. Yeah, you know, we're a socialized country like Sweden, etc., but the socialized nature is only in medicine. In dentistry, we're fee-for-service, so we are different than in the United States because we do not have capitation plans, so we have no HMOs or PPOs in Canada, which means that when a patient comes in, about 85% of my patients have insurance, which will cover some of their dentistry. So for instance, they may come in and say, I need a root canal, and 80% of a root canal will be covered up to a certain portion per year, and they're responsible for 20%. Unfortunately, implants have been slower to catch on. Some dental plans now are supporting the actual placement of the crown as an alternative because they've seen that the longevity for implants is greater than the eight years it is for a 3-unit bridge. They'd rather do an implant because the next time it's going to be a 5-unit bridge. So we see in Canada fee-for-service. We see a very good level of education on a basis with all the American universities. You know, I have some people ask me, I say, well, do you see a lot of hockey players who are missing teeth? And I say, no, but we have a population which is very, very North American-like. And again, I think in many ways the dentistry is nicer because I don't have to worry about cut rate dentistry or capitation mills. It's still, you know, the solo practitioner is still surviving. Having said that, I will say that dentistry is much more competitive in Canada, and the big urban centers like Vancouver, where it's a $3 million city, or 3 million people city, it's very competitive. There in Toronto, the bigger cities, it's very difficult now because our students are graduating with huge debt, similar to US, $200,000, $300,000 in debt, sometimes even more from dental school alone. And if they try and buy a practice, it's hugely expensive, and Vancouver is a very expensive city to live in. So the dentistry has benefits, and when we look at Canada as in general, it's the same type of dentistry. Maybe we're able to do more implants simply because there's not this idea that we've got to look for the cheapest dentist. They're looking for quality still. Yeah, it's an interesting question because in the United States, the FDA looks at the marketing of things, and in Canada, it's Health and Welfare Canada, and we have to get a CE stamp. So Canada can be one of the toughest spots to get your products approved. You have to get a CE stamp, and it can be incredibly difficult, even easier sometimes in the US. So when I travel a fair amount to different cities to lecture and I talk to the dentists, we share many similar things, you know, how we treat patients. We share similar problems with problems in the practice, staff management issues. There's very many similar things between Canada and the United States. Some things are more difficult. I think to get products approved in Canada is more difficult, and we have some benefits too. I think we have a situation where we don't have capitation plans, so I do think that helps us, and to some degrees it's fee for service. Well, I love photography, and I think that comes out in my clinical cases. I find it's a nice hobby to have. I have two children who are grown up now. I have a 21-year-old daughter who was an ice dance figure skater, made it to 7th in the country in ice dance, and I have a son who's got a college scholarship playing soccer in Vancouver, so I love to watch them. My daughter's just retired this year. My wife Leanne and I have been married for 24 years. We like to travel a little bit as well. And I still play old-timers hockey. The older I get, the better I was. I'm playing with my son there. I like to travel. I like to write. I'm writing articles mainly in dentistry, and I love our profession. I'm fortunate that I don't go to work because I have to. I go to work because I want to, and I love to learn. And one of the things, getting back to the guide again, is that this was a fantastic year for me because I really learned a tremendous amount, and I feel like I came here today and I saw a lot of old friends here, and this is a very family type of place, and that's important to me, to continue to learn. And I guess I leave with the 5 things that I always try and live by, which is the 5 L's, and it's to love, to live, to learn, to laugh, and to leave a legacy. And so I hope that those 5 things come across in the lecture that I gave today. And if you ever have any questions or you want to ask me anything about the other L word, which is lasers, you can drop me an email at glennvanass@me.com, and I'm happy to respond. It's a great place you have here, Paul. It's an honor to be asked to lecture here for Guide, and I've truly enjoyed my year here and today, and I hope that comes across in the lecture itself.